Welcome back. From September 11th to the 16th, health professionals across the country acknowledged Suicide Prevention Week. According to CDC data, there were 49,000 deaths by suicide in the United States. Dr. Peter J. Franz, a clinical assistant professor at the Psychiatry Research Institute at Montefiore Einstein, will provide insight into the factors contributing to this increase. Doctor, thank you so much for joining me.
My pleasure. Thanks for having me.
Now, as I mentioned, according to CDC data, more than 49,000 people died by suicide in the U.S. this year. This doesn't include the people who may have attempted or even thought about suicide, so this is obviously a very alarming number. Can you just explain why we may be seeing this increase?
Yeah, it is a really alarming number, and it does appear that suicide may have been on the rise for about the last 20 years. But one reason we might be seeing that is because suicide's actually decreased for the 20 years prior to that. One thing that I think is alarming and interesting is the fact that in 2019, the suicide rate was effectively equivalent to what it was in 1919, suggesting that suicide hasn't really changed all that much over time. And compared to many of the other leading causes of death that have shown really big reductions, suicide hasn't really budged. And that's a problem that we need to think about carefully. We need to investigate it further and find better ways to help people who are struggling.
Now, as we recently had a topic about mental health and young children and teenagers and even young adults, what does the latest data say about this demographic of young people?
So these kinds of problems are particularly concerning in young people. For one, especially in the mid to later teenage years, this is the time frame when suicide thoughts tend to begin, when people first start experiencing those types of challenges. And this may be due to many of the challenges that you and I both encountered as teenagers. It's the beginning of starting life outside of your nuclear family, where you begin to have romantic relationships, start to think about what the world might be like as an adult, and starting to take on some of those adult roles. And with that comes stress. It's really, really hard to navigate adolescence for anyone. And for some people, they may need a lot of extra support. And so being able to identify when a youth is struggling is likely key to preventing the onset of suicidal thoughts.
And I also want to expand on that because I think when you're an adult, maybe you could take a little bit more charge of your life, or you can monitor yourself more. But when you're a young person, you may be going through something and not even know it. So can you possibly speak to that on just how that age difference, how we see that play out in that age group?
Sure. Young people have less experience going through the world, and they have less experience relative to old people with themselves. And the signs and signals that we might be struggling can be subtle. They can be as much as a small change in our sleeping or eating habits. They might be reductions in activities that we typically enjoy. They might also be reaching out to our friends less. And these things might not be dramatic differences. It might be small incremental changes on a daily basis. And that's something that as we get older, we should start to really look inward and monitor as signs and signals that we might need help.
Now, the CDC classifies deaths by suicide and suicide attempts as a severe public health challenge. What should our audience know about suicidal thoughts and the impact of losing someone to suicide?
So, suicide is a major public health crisis. It's the 10th leading cause of death overall, and it's the second leading cause of death among individuals 14 to 44. Now, because of how common this is, it's something that might be going on around us that we don't even know about. Someone might be struggling and we're unaware because they haven't told us. And so it's important to ask other people if they're struggling. But also in terms of someone who's lost a person to suicide, a loved one, what we might call a survivor of suicide loss, these are people who are likely to be struggling as well. It can be really, really hard to have lost someone in any fashion, but suicide is particularly challenging because suicide is a stigmatized act, and the person who loved the individual who was lost may experience that stigma as well and may have difficulty reaching out for help.
Now, on a smaller scale, are there certain risk factors that makes a person more vulnerable to suicidal thoughts or death by suicide?
We know there are a lot of pretty big risk factors. So these include serious mental health concerns. These include hopelessness and feelings of social isolation. They also include prior suicidal thoughts and behaviors. And so Those types of risk factors, coupled with especially stressful life events like the loss of a loved one, loss of a job, for example, when we notice these things happening with others around us, it's a time that we should reach out to them, to offer support, to be kind and to be caring, and to ask how they're doing.
And I also think that I know a lot of people talk about this, especially young people, like when they want to be left alone, they want to be left alone. How, as a person who may be struggling, how do you accept that? And, like, what should you think about if somebody is trying to help you?
So it can be very hard to accept help, because accepting help means acknowledging that a problem is going on. And because mental health problems are hard to talk about, they are in many ways stigmatized, and they can be embarrassing or shameful to a person experiencing them. And that's one of the reasons I think it's particularly important for people in your close social circle, your friends and your family, to check in regularly to see how they're doing, even in times that you're not concerned about a crisis. That way they know they can trust you, they know you care, and they know these are the kinds of things they can talk about.
Now, according to the CDC, boys and men were 4 times more likely to die by suicide than women. Males make up 50% of the population, but nearly 80% of suicides. What could be contributing for us to see that?
There's likely a large number of factors that are contributing to the substantially higher number of suicides that we see in men. One big one might be firearms. Firearms are the cause of suicide death about 6 times more for men than they are for women, and that's a statistic that we see across the globe. And so it suggests that firearms, which are a highly lethal means of attempting suicide, may be playing a specific role for men and their suicide deaths.
Are there bigger trends in our country or culture that could be influencing these rates? I know a lot of people think social media could be influencing, or exposure to certain things. In your research or in your study, have you noticed anything like that?
So on one hand, I think that one of the important factors, and something that I think just as this conversation is demonstrating, is that an increase in public awareness of the problem of suicide, how to detect or identify it, and how to help people is really important. And I do think that's increasing. So in that respect, we're really going in the right direction. But I also think when we talk about social media, we can consider the fact that virtually all young people are engaged in some form of social media on a daily basis. And there are lots of places on the internet where people might go that could be harmful, that could impact their mental health in a negative way. But we're also starting to realize that there are places on the internet that can be wonderful places where they can find support from peers and from other types of resources. And so one of the keys that we're looking into is how we can guide individuals to find that kind of supportive resource online.
Now, if we're worried about a friend or a loved one, what should we be on the lookout for?
The big things that we should probably be looking out for are changes in their normal behavior that suggest they're not doing so well. So just like I was talking about before, people who are not engaging with others in the same way that they typically do, who aren't enjoying the activities that they often do. But our experiences, our emotional lives are private. And without asking, it's hard to know what someone else is feeling. And so I think that the big thing we should be aware of is that it's important to be checking in with someone, that if you have a sense that they might not be doing well, ask them. And if you have the sense that there's a possibility they might be contemplating hurting themselves, ask that too.
Oh, wow. So, I think that's very shocking to hear, because and maybe this is something as a society that we can move and evolve, but to be so forward, what are the pros of that? Or, why would you encourage that? I know that could be very hard for somebody to do.
Definitely. It may be an uncomfortable question to ask or conversation to have with an individual, but if you have reason to believe that someone's struggling or they may be at risk for suicide, one way to demonstrate care and support for that person is to ask them about that experience, to ask them what's going on for them. And it's also the only way that we could start to provide the kind of help they may need, including suggesting resources for them or simply being there as their friend, as someone who cares.
And I also want to bring up support groups. Can you just tell us a little bit about just why those may also be another outlet for people who may be struggling?
So support groups can be really critical. I think the biggest reason that many support groups might help people, especially those who are struggling with suicide, is that many people experience suicidal thoughts or suicidal acts in private. They don't share them with others. And that by recognizing that other people go through similar things can be intensely therapeutic. It can be the realization that I'm not the only one experiencing this. And our research, and that by many others, suggests that that can be really important for helping people to recover. But it also can be helpful therapeutic groups in terms of helping people build a social network where they can get support, where they can meet other people and engage in the kind of social activities that we know is helpful for mental health generally.
Now, what are some treatments for depression and complex mental illness that can help?
Well, there are many. And over time, we've developed lots of different types of treatments. These can be ranging from talk therapy, where individuals process the challenges they experience in their life by talking about them with a supportive therapist of some kind. They may also be the kind where people start to build skills to help them identify the types of challenges they're experiencing and ways that they can cope with them. And there are, of course, also medications that people can take. I think the really important thing for people to recognize about mental health treatment is that when they're struggling, there is a treatment out there for them. And that working with a provider, you can identify what's going to work for you, what's going to be the most comfortable, and what's going to help.
And what is something that we can all do because stigma is a really big, although we are evolving and we're growing so much, stigma is still, around. What can we all do to make sure that no one feels embarrassed or, is hesitant to talk about this?
I think we can do exactly what you and I are doing today, which is to talk about mental health, to talk about suicide, to acknowledge that this is a problem that lots and lots of people experience, and to identify that there's lots of ways that people can get help, and that getting help for mental health concerns is as important as getting help for anything else. And so I think talking about this and identifying that there are lots of resources out there might really help to reduce stigma and increase the extent to which people feel like they can ask for help.
Well, I want to thank you so much for joining us and having this conversation. I think this is something that we need to talk about more, and I'm happy that we can talk about it, especially in this community. I know a lot of communities tend to struggle based on your culture. They can struggle with talking about mental health, so I appreciate you taking the time to talk to us about this.
It's my pleasure. Thanks so much for having me.
If you or someone you may know may be in a crisis, please go to the website www.afsp.org or call or text 988 or text TALK to 741-741. Stay tuned. We have more open for you right after this.